One of the legislative issues you'll be discussing on Hill Day is the Occupational Therapy and Mental Health Act. This presentation will give you some background on what's going on with mental health on the Hill, as well as some details on the legislation that you'll be talking to your members of Congress about. AOTA's advocacy efforts around mental health are happening at a time when both the American public and lawmakers are more focused on the need for better mental health services in our country. Recent tragedies have certainly exposed the inadequacies of mental health care in our country, and people are starting to understand that we need a full reform of the mental health system. In addition, people understand that we also need a better connection between the mental health system and the physical health system, and occupational therapy is particularly well suited at this integration between both worlds because we're experts in both mental health and physical health, or our interventions help people with both mental health disorders and physical health problems. Systems reform is definitely coming about because we cannot ignore the disparities for people with serious mental illness, both health disparities as well as the disparity in care in general. And these are both financial, the cost on our entire system, and ethical. There are currently 4 bills in Congress that could lead to mental health reform, and it's important to know something about these for 2 reasons. The first is you may be in an office of someone who is a main sponsor of these bills, and second, people may ask you about the bills. So you don't need to know the details of each one, but it's good to know that something is happening and what the larger context is. Representative Tim Murphy has introduced the Helping Families in Mental Health Crisis. This is the 2nd year in a row that he has introduced this bill, and Tim Murphy, while his legislation is considered controversial by many because of some of the provisions in there, he has been a major advocate for mental health reform and deserves a lot of credit for keeping this issue in the spotlight and not letting leadership put it away. So he continues to bring this forward. There are currently no occupational therapy provisions in this bill, but there is a focus on some issues that we would be interested in, such as psychiatric rehabilitation, including supported education and employment. We have spoken to his office and to Mr. Murphy, and we continue to have conversations with him about occupational therapy and mental health. Next, the Committee of Jurisdiction, the committee that would oversee a mental health bill or a comprehensive mental health bill, the Energy and Commerce Committee. There have been talks that they are developing a bill. They may have used Mr. Murphy's bill or Dr. Murphy's bill as the baseline bill, but they're creating their own, something that would be more likely to pass on a bipartisan basis. So the Energy and Commerce Committee, both the Democrat and Republican staff, over August started working on a bill. We haven't heard the results of that, but this is also exciting because if the committee's working on a bill, it may mean that a bigger bill would move. Over on the Senate side, right before the August recess, Lamar Alexander, who's the chairman of the Senate Health, Education, Labor, and Pensions Committee, and Patty Murray from Washington, who is the ranking member, the top Democrat on the Health Committee, introduced a bill called the Mental Health Awareness and Improvement Act. This introduction was a signal that that committee, which is the one that has jurisdiction over mental health in the Senate, is also interested in considering mental health legislation. And finally, the Mental Health Reform Act was introduced by Senators Bill Cassidy of Louisiana and Senator Chris Murphy of Connecticut, also before the August recess. This is a comprehensive, clearly bipartisan bill that we are also very interested in. There are several workforce provisions in this bill that we think really align with occupational therapy and that it's something that we could be added to. So we've sent letters of support for all 3 bills that have been introduced. So if anyone asks you if AOTA is supportive of these bills, you can say that we have, and we are also continuing to work continuing to work with these offices and your efforts on by talking to the offices and by getting co-sponsors of our OT and mental health bill will just help our efforts to possibly have provisions included in these bigger bills. Now that we've talked a little bit about the big legislative efforts that are going on, I think I want to take a step back about why occupational therapy needs to be in comprehensive mental health legislation. Occupational therapy really has a distinct role to play in mental health services, and I would like everyone to try to be as comfortable as possible before your meeting in trying to explain the role that OT can play for people with mental illness. And one of the key pieces is really helping with that day-to-day independent functioning. That's the piece that is not as well addressed by other professions. Other professions have their role in helping with day-to-day functioning, but not in helping to address those basic skills that are needed. How do you take care of yourself? How do you organize your day? And serious mental illness can really have an impact on the cognition and the executive functioning that's needed for that day-to-day planning and independent functioning. Occupational therapies work with their clients to establish goals, so that's also a key piece, is that these are client-based goals on what someone wants to do to participate in home, school, workplace, community. And also we teach and facilitate the skills needed in problem solving, medication management, safety, social skills, activities of daily living, leisure interests, stress management, all things that can be affected by serious mental illness that are really essential to living independently after one has recovered from that episode. In addition to understanding that there has been an increased talk about providing better mental health services, something else to know is that the federal government has recently recognized the role of occupational therapy in quality mental health care. Several years ago, a Medicare mental health provision came out that required that people receive evaluations for occupational therapy services. And then within the last 2 years, the Substance Abuse Mental Health Services Administration, or SAMHSA, have come out with 2 programs that when they talk about staffing or people who should be considered for staffing, they have listed occupational therapy among those staff. And that's for their new community behavioral health centers that are being established, and there are also these primary behavioral health integration grants. Both list occupational therapy. So the recognition by the federal government and the inclusion in these regulations is it really recognizes the important role OT can play in integrating physical behavioral health and helping to achieve results for long-term independence for people with mental illness. And this leads me to our issue for the day, which is the Occupational Therapy and Mental Health Act, or H.R. 1761. This is a bill that was introduced by Representative Paul Tonko, who's a Democrat from New York, and Representative Mike Kelly, who's a Republican from Pennsylvania. The goal of this bill is to increase the occupational therapy workforce practicing in mental and behavioral health. It would modify the National Health Service Corps, which is a loan forgiveness program, to include occupational therapists under a category of mental health practitioners. Occupational therapists who work in mental health settings in high needs areas would be eligible to participate in this loan program. I do want to make a note that currently this only recognizes occupational therapists and not occupational therapy assistants to participate, and that's because every other profession that's within this loan program is a master's level program or higher. I'll talk a little bit later about why I think passage of this bill will help all occupational therapy practitioners. So why did we choose to focus on the National Health Service Corps? There are really 2 reasons why. The first is the inclusion in this program would encourage new occupational therapists to practice in mental or behavioral health in high needs area because they would receive loan forgiveness. So You should know if you're an occupational therapist and you go into a skilled nursing facility or any other facility or placement besides mental health, you wouldn't be eligible. And that sets us apart from other professions who are trying to be added to the National Health Service Corps. Secondly, the National Health Service Corps is the only place in federal law where the term behavioral and mental health professional is defined. So by being included in this definition, we're now included in law as a mental and behavioral health professional. And people do go back and they look and they say, how does the federal government define a mental and behavioral health professional? So we would now be defined that way in federal law. And that's where the benefit comes for all practitioners, especially at the state level. When states are looking to develop programs, they sometimes go back to these federal definitions in order to determine who they should include, both for reimbursement or for inclusion in a program. So if we can get added to the National Health Service Corps through this bill, H.R. 1761, we would now be in the federal definition of mental and behavioral health professional. Another really important point is that the other professions that are currently eligible for loan forgiveness as mental and behavioral health professionals under the National Health Service Corps are either openly supportive of our inclusion or neutral, or they've decided to remain silent. This support is very rare, but we think that it means that other professions understand the unique role of occupational therapy in helping people with mental illness. We have a letter of support from the Mental Health Liaison Group, which is an umbrella organization for mental health advocacy groups in Washington, D.C. This letter is included in the congressional packets, and so if people want to know what do the other professions think, it's a great letter to show them. Ultimately, our goal from these meetings is to continue to gain bipartisan supporters for the bill in the House, an introduction of the bill in the Senate. So if you're going to the Senate side and you're showing the bill, people will say, is there a Senate version yet? And you can say, no, but we're really looking for us key supporters in the Senate. We do have people who are interested in introducing, but they want friends. They want other people to be supportive. So in a Senate office, we don't need someone to take the lead, but we do need other people to be supportive of the bill. So if you get feedback from the House or the Senate where someone's very enthusiastic about the bill, be sure to let us know in your feedback for the day. Part of our goal here is also to continue to educate members of Congress and their staff about the role of occupational therapy in mental health. Because as we talked about earlier, we'd really like to see an occupational therapy mental health workforce provision in any larger mental health legislation moving this fall. So number one, we want to get sponsors or introduction of the bill. But number two, we want people to say, yeah, we think this should be included in a larger bill. And I'm going to add a number three, which isn't on the slide. But we're also supportive in general of broad mental health legislation moving. We want Congress to help reform the system and get people the services they need, because that is still in question as well. So it's okay to voice our blanket support for moving a mental health bill. Both of the bills that you're going to be talking about today are budget neutral. That means that they don't spend any money. The bill that was introduced this year, the OT and mental health bill that was introduced this year, is considered budget neutral. It has what's called trigger language in it, so that we cannot start getting new funds until the National Health Service Corps also gets new funds. This makes it budget neutral and means that it doesn't require any new spending. For many offices, this is a very important thing. They don't want to sign on to bills that are going to spend more money, but they are willing to sign on to bills that help make policy changes. So if you haven't listened to anything else in here, to me, these are the most important slides. How to structure your meeting. Be sure to take the time to make sure that the staff understands how occupational therapy services can help people with mental illness before you ask for support for the bill. Once you've gotten their buy-in, it can really help pitch the bill itself. So be sure to describe how mental illness can affect daily routines, function, and the ability to participate in life roles. And also use vignettes and personal experiences to make that point. You can think broadly about occupational therapy in a mental health setting, but if you haven't had that experience, you can think about mental health for schools, veterans, community-based, or geriatric, whatever you're the most comfortable with, really making that link between mental health and the ability to participate day to day. After you've gotten their understanding of occupational therapy's role in mental health, then you can ask for support for the bill, that we'd like them to co-sponsor or support introduction of, in the Senate, support similar legislation in the Senate, but we'd like them to co-sponsor this bill we have, H.R. 1761, which would add occupational therapy as a mental and behavioral health professional in the National Health Service Corps Loan Forgiveness Program. Our other goal is to have them support the inclusion of occupational therapy in an occupational therapy mental health workforce provision in a larger mental health bill. So there is a shortage of mental health people who work in mental health, whether that's OT or other professions, and we would like occupational therapy to help fill that gap and really provide those needed services.